Hello my dear doctors, welcome back now. Now we are going to begin with the pelvis and perineum topic. Now this topic is one such topic which is like very simple in anatomy, but the problem is that because the students don't have a proper orientation, especially in the first year of MBBS, because of that reason it looks like very complicated or a tricky topic. Otherwise it's a very simple topic. Just follow in the same order all the topics which I am teaching so that it will become very much easier for you guys. So first I'm going to start with the diaphragm, that is your pelvic diaphragm and urogenital diaphragm. Let's see what is the clarity between these two. And once you're comfortable with those two diaphragm, then we'll study about the perineal body and then later on the most important part, that is the peritoneal pouches. Okay. So let's first of all begin with the diaphragms guys, pelvic diaphragm and the urogenital diaphragm. Now in this diagram, the diagram that you're able to see on the screen here right now, it's actually the pelvis, female pelvis in fact, and that is the sagittal section of the female pelvis. Now in the sagittal section of the female pelvis, you are able to appreciate certain muscles which are actually present here, the sloping down, and these muscles which are sloping down from there, those are the muscles which are actually going to form the pelvic diaphragm. That pelvic diaphragm is present all the way up to here. In this section it is not shown guys, but that is the pelvic diaphragm, and that is the one which is separating the pelvis above from the perineum below. So you'll actually have the pelvis above and the perineum below. Those two are separated by the diaphragm there. The diaphragm is pelvic diaphragm. Very much important, is actually supporting the viscera, pelvic viscera. And then if you are comfortable with this pelvic diaphragm here, then sir, where is the urogenital diaphragm here? Now in the same diagram, observe here, you'll be able to find some more muscles over here. This is the one which will be known as the urogenital diaphragm. And there you can clearly appreciate there'll be like one opening for urethra and then there'll be a separate opening for the vagina. So urethra, uro, and vagina, genital, urogenital diaphragm. The name is very much meaningful. Now this is actually in the female. Do you have exactly the same thing in the males also? Yes, let's have a comparison here guys. Now look at this diagram of sagittal section of the male pelvis. Again the same thing in the male pelvis also. I'm able to see these muscles which are sloping down here. Those will be the pelvic diaphragm. And then below the pelvic diaphragm, again you are able to appreciate the urogenital diaphragm. But here there is a difference between the male and the female. In males, in the urogenital diaphragm, you have actually only one opening here. That is only one opening for urethra, for the passage of urethra there. Why? Because in males, we know very well that urethra is the common passage for both urine as well as the semen. So urogenital diaphragm in females will actually have like two openings, separate opening for urethra and the vagina, whereas the urogenital diaphragm in males will actually have only one opening for the urethra. So I think now, at least now, you got a clarity between the pelvic diaphragm and the urogenital diaphragm. The moment you look at this kind of diagrams in your exams, I hope you will not get confused. Okay, what is pelvic diaphragm and urogenital diaphragm? Now let us deal with these two topics separately guys. So first let's deal with the pelvic diaphragm. Now what is this pelvic diaphragm made up of? Remember, pelvic diaphragm is just made up of two muscles here. So first let us write down in the notes here and then later on I'll even show you in the diagram also guys. Pelvic diaphragm is just made up of two muscles. Number one, it will be made up of levator ani muscle. I think you have heard about this a lot of time in obs gynae. It's interchangeably used. Some people specifically call it as pelvic diaphragm or sometimes it is levator ani. So pelvic diaphragm, it's almost similar to levator ani only. So number one, it is made up of levator ani, and number two, it is made up of coccygeus muscle. Coccygeus muscle. Now this levator ani muscle, it's in turn made up of two more muscle. One will be the pubococcygeus muscle. One is pubococcygeus muscle and another one will be iliococcygeus muscle. Iliococcygeus muscle. And if you are comfortable with this one, remember another name of coccygeus, it is also known as ischiococcygeus muscle. Oh my god. You might be like, what is this? You're confusing a lot. Pubococcygeus, iliococcygeus, ischiococcygeus and all. Don't worry, I'll make it very much simple for you. Now after writing these notes over here, let's again go back to this diagram here guys. In this diagram, I'm able to see the entire pelvis. But right now, we'll do one thing here. Out of this entire pelvis over here, let me just remove only the pelvic diaphragm out. So once you remove this pelvic diaphragm out here, the diagram is something like this. I have selected wantedly a schematic diagram here. Why? Because if you see the real-time image with all the muscles, you will not be able to differentiate between them. That is why with the help of these colors, we'll be easily able to differentiate them. So just observe here. Now in this is the pelvic diaphragm that we have removed. And now how to make this topic easier, guys? How to learn about the pelvic diaphragm in an easy manner? Simple thing. Learn it in this manner, guys. Our hip bone will actually have three parts: ilium, ischium and pubis. Even a first year MBBS student knows that. Our hip bone will have three parts: ilium, ischium and pubis. And the only thing that you have to do here is that from each and every part, there is a muscle going to the coccyx. Okay. So somewhere here in this diagram, you actually have your coccyx. Okay. And right in the front here, of course, there will be pubis, which is actually going to form the pubic symphysis there. From either side, you'll be actually having the pubic bone, pubic symphysis. And then you actually have that ilium part, the big expanded part is ilium. I'm just writing here as ilium. And then ischium will actually have a spine here. This is nothing but ischial spine. So make it simple, guys. Hip bone will have three parts: ilium, ischium and the pubis. And from all of them, there is one muscle going towards the coccyx. Just for the sake of remembering, I'm telling you, remember like this. So from the pubis towards the coccyx, that is pubococcygeus. Perfect. And then from the ilium towards the coccyx, that is iliococcygeus. Perfect. Okay. And don't get worried about this puborectalis, guys. I'll tell you about that. Like what is the importance regarding that, I'll tell you within few minutes. Now concentrate on pubococcygeus and iliococcygeus. These two muscles together, they are going to form levator ani. That is the number one. And lastly, what is left out here? We are left out with ischium. From ischium towards the coccyx, that is ischiococcygeus muscle, which is also known as the coccygeus. That is our number two. But remember, in human beings like you and me, this coccygeus muscle is actually a vestigial one. It doesn't have any function. Its function is seen actually in the quadrupeds. The animals will be walking on that four legs, having a tail. And of course, we don't have a tail. The movement of the tail will be with the help of that coccygeus muscle, guys. So in our human body, it is the only function of that. It is involving in the formation of this diaphragm, pelvic diaphragm. Wow. So I think now the things are becoming easier, guys. Let us again go back to our notes now. What we have written there. Pelvic diaphragm is made up of two muscles. Okay. One is levator ani, another one is coccygeus muscle. But now don't get confused with the remaining things over there. Follow my trick there. From all the three parts, there is a muscle going towards the coccyx. So ilio, pubo and ischio. Out of that, pubococcygeus and iliococcygeus, these two together, levator ani, and ischiococcygeus alone is known as the coccygeus one. Wow. This makes the pelvic diaphragm easy, guys. I hope it is crystal clear in this diagram now. Now let us do one thing here. This diagram that you are able to see on the screen of pelvic diaphragm, this is the one which we are actually seeing from above. I mean to say from the pelvic region. From above, from the pelvis we are seeing. Now let me do one thing. This pelvic diaphragm, let us turn and let's see from below, inferior aspect. I mean to say from the perineum aspect, or in the lithotomic position we can say. I hope you're getting the orientation. In this topic, the most important thing is orientation, guys. Why students fear? They're having a phobia with pelvis and perineum topic. No orientation. They'll not be able to understand which diagram is shown in which direction. So this is the pelvic diaphragm that we are actually seeing from above. But now let's turn this and let us see in the lithotomic position. So it will be something like this. Now in this diagram also, again the same thing here, guys. What do you have in the front here? This will be pubis. So therefore this muscle has to be the pubococcygeus. Then the ilium part. Therefore this will be the iliococcygeus. And then the ischial spine here. So therefore definitely there should be coccygeus muscle over here. So this is the diagram that we are actually going to draw, and there is a beautiful concept here. Let's have a clarity in that one. So it's not like nothing new topic here. Same topic we are continuing, guys. We are still studying about the pelvic diaphragm only. But orientation is different. Now we are seeing the pelvic diaphragm from inferior aspect, from the perineum side. So imagine this one here to be your pubic symphysis, and this is the ischial tuberosity here. No need to write down the names and all, I'll make you write down later on. So that is pubic symphysis, and on either side will be having ischial tuberosity, and between them there will be ischiopubic ramus. And then somewhere here posteriorly you'll be actually having the coccyx and sacrum. Sacrum and the coccyx there. Now between this sacrum and the ischial tuberosity there will be a ligament here. Between the sacrum and the ischial tuberosity there will be a ligament here. That's the reason why the name of that ligament will be sacrotuberous ligament. From the sacrum to ischial tuberosity, tuberous, sacrotuberous ligament. So those are all the boundaries of the perineum. We'll write it later on. Don't worry about that part. That is not our focus right now. Our focus is only on the diaphragm right now, pelvic diaphragm. Now imagine this one to be a female perineum. So if it is a female perineum, then you will be able to appreciate a separate opening for urethra, the urethral orifice, urethral opening, and there will be a separate opening for vagina, the vaginal opening, and there will be a separate opening for the anal canal, the rectum, anal canal. If it is a female perineum, you'll be able to appreciate these three openings there. Now welcome to what are the muscles which are actually forming the pelvic diaphragm. From the pubis to the coccyx, definitely this has to be the pubococcygeal muscle. Then from the ilium part towards the coccyx, that is iliococcygeus muscle. And then from the ischial spine, you'll be actually having ischiococcygeus, or simply it is known as the coccygeus muscle, guys. So just try to understand. So we have got like three muscles. Let us even write down their names, guys. What is this one here? From the pubis towards the coccyx will be pubococcygeus muscle. This one is from the ilium towards the coccyx, so therefore iliococcygeus muscle. And this one here will be from the ischium towards the coccyx, so therefore ischiococcygous muscle. Perfect. So pubococcygeus, iliococcygeus and ischiococcygous muscle, guys, all the three of them. And out of these three muscles we have just now discussed, the pubo and ilio, these two together are going to form levator ani, and the separate one ischiococcygous together going to form the pelvic diaphragm. I think we don't have to mention that again. Now basically what I'm trying to teach you here, what is going to happen is, what is the muscle which is very much most closely present towards all those openings, guys? Pubococcygeus. That's the reason why pubococcygeus muscle is the one which will be contributing to these fibers around those openings, guys. So those fibers which are around the urethral orifice or urethral opening there, those muscle fibers are nothing but your pubo-urethralis. Similarly, from this muscle, that is pubococcygeus muscle, there are certain muscle fibers contributing to that opening, and the next opening, that is vaginal opening, pubo-vaginalis. And similarly, from the pubococcygeus muscle, there is one more modification here. Muscles are sent around that rectum, that is why it is pubo-rectalis. First, let us write down the names of all these three muscles here. Let me use another color. So what is the name of this one here? Pubo-urethralis. The name is very much meaningful, guys. Don't get any confusion here. Just calm, cool, relax and learn about this one. So pubococcygeus muscle is contributing to or modifying, and certain muscle fibers are present around that urethral opening, pubo-urethralis. What about the name of this muscle around the vaginal opening here? That is pubo-vaginalis. And what about this one here? This is pubo-rectalis. And already this has been tested in your exam. These three muscles are the modifications of which one? And from our diagram, there is no doubt about that. These three are nothing but the modifications of the muscle which is the closest one to that one. So these three are modifications of pubococcygeus muscle. Hope the concept is like crystal clear now. So these three muscles, that is pubo-urethralis, pubo-vaginalis and pubo-rectalis, those three muscles are actually the modifications of pubo-coccygeus without any doubt. There should be no doubt in your mind that it might be iliococcygeus or ischio-coccygeus, something else, nothing else. It's a modification of pubo-coccygeus, crystal clear from our diagram. Now, one more MCQ that we can solve from here. What about this pubo-rectalis muscle, guys? Pubo-rectalis muscle, it is actually the one which will be going from the pubis and going around the rectum and again coming back here. Let me show you a diagram for this one so that it becomes very much easier. Yes, look at this one here, guys. So here you have got the pubis, and from there you can see, appreciate the muscle there, that is pubo-rectalis muscle, this one. And that pubo-rectalis muscle is actually going around that rectum and again coming back. Because of this, what is going to happen? There is a rectum above here, and then there will be anal canal below here. And between them, a rectum and the anal canal, there is a formation of angle. And this angle between the rectum and the anal canal, that is referred to as the anorectal angle. Anorectal angle. Now, when this muscle is forming that anorectal angle, you just look at my hand here. Imagine this one to be the rectum and this is anus here. And it is going to, form an angle there, anorectal angle. When this angle is formed here, then the person will not be able to defecate. So at the time of defecation, what is going to happen? Yes, this muscle relaxing, and therefore the rectum and the anal canal will come in the same line and the person will be able to defecate easily. So that's the reason why this was the muscle which is actually controlling at the time of defecation. It is the one which is controlling that anorectal angle. That's the reason why this muscle is actually referred to as muscle of continence, not incontinence, muscle of continence. So out of all these muscles over here, which is referred to as the muscle of continence, that is pubo-rectalis. That is the muscle of continence. Pubo-rectalis muscle, it is the muscle of continence, guys. Hope the concept of pelvic diaphragm is like crystal clear, and all the MCQs which we have actually covered. So we have seen the pelvic diaphragm from above, from the pelvic region, and from the below, that is in the lithotomic position from the perineum region also, guys. Perfectly done. Now guys, after completing about the pelvic diaphragm, now let us move towards the urogenital diaphragm. Already in the very beginning, I gave you the introduction. You are already familiar with this diagram. Female pelvis, and in the female pelvis, you are able to appreciate urogenital diaphragm here. Similarly, in the male pelvis, you are able to appreciate that there is urogenital diaphragm over here. Now, what we are going to do, again the same thing here. In this diagram, you are able to see entire pelvis, all the pelvic viscera, everything over there. From there, let us just remove that urogenital diaphragm, guys. This is how it looks like. That's the urogenital diaphragm. The moment you look at this diagram, all my students can easily identify which is in the female and which is in the male. The one which is above here, having two openings, one for the urethra and one separately for the vagina, definitely it is in female. That is the female urogenital diaphragm. And with only one opening there, it is in the male. That is the urogenital diaphragm in the male, guys. So female and the male. Now, what is this urogenital diaphragm made up of? Again, the same thing. Even this is also made up of two muscles. Wow. So the concept is getting a little bit easier right now. Pelvic diaphragm is also made up of two muscles, and now urogenital diaphragm, it is also made up of two muscles, guys. Now, what are the two muscles? You will be able to appreciate one muscle which is around that urethral opening, external urethral sphincter. External urethral sphincter muscle. And then one more, there is a muscle which is actually traveling transversely, and this one will be referred to as your deep transverse perineal muscle. Deep transverse perineal muscle. These two muscles are the one which are contributing for the formation of urogenital diaphragm. And exactly the same thing in the males also. Let's see once and the concept will become clear. External urethral sphincter muscle and the deep transverse perineal muscle, same in the male as well as in the female, guys. So urogenital diaphragm is made up of number one, external urethral sphincter muscle, and number two, deep transverse perineal muscle. In short, we can call it as DTP. So deep transverse perineal muscle. external urethral sphincter muscle and the deep transverse perineal muscle, guys. Now, apart from these two, something more important, much more important now. Are you able to appreciate one fascia above this one? In the urogenital diaphragm, you'll be able to appreciate one fascia above. That is superior fascia. Be very careful. It's not superficial. Come on. So start building the concept from here itself, guys, and that will help you in learning about the perineal pouches easily. So there is a superior fascia, and below you'll be actually able to appreciate one inferior fascia here. And that inferior fascia, something important, it is the one which is also known as the perineal membrane. Extremely important, guys. So apart from the two muscles, you also have a fascia, one fascia above, one fascia below. Simple name, superior fascia and inferior fascia. But remember, inferior fascia, it is also known as the perineal membrane. And the same thing again and again, we are doing the same thing, comparing the male and the female, guys. Yes, in the males, you are able to appreciate here superior fascia, and yes, there will be an inferior fascia. And inferior fascia is also referred to as perineal membrane. Even that is actually a part of your urogenital diaphragm. So let us just include in our notes here. Please write down the full name here, guys. Superior fascia. Why? Because usually we have a habit of writing just SUP, and I have seen most of the students while revising, they are calling it as superficial. It's superior fascia. Number 4, they will be inferior. Inferior fascia of urogenital diaphragm, which is also referred to as perineal membrane. Perfect. So that completes our next topic here, that is urogenital diaphragm. And I think now you have a clarity between the two things, that is pelvic diaphragm and the urogenital diaphragm. So the moment you look at these kind of diagrams now you'll not be getting confused which diaphragm is present over where. So we are now comfortable with the pelvic diaphragm and the urogenital diaphragm. Now let us move towards the next topic, that is perineal body. First of all, what is perineal body? Now look at this diagram on the screen here. You are able to see that is a female perineum. We are able to see a separate opening for urethra and the vagina and the anal canal. Now in this female perineum, in the middle here, you'll be able to appreciate one fibrous, a dense fibrous tough body, and that body is actually referred to as perineal body. Now this is something extremely important and trending topic nowadays, and let us study this in a very conceptual manner, guys. Okay, so I want you all to concentrate fully here. So now what is a perineal body? First of all, try to understand. The perineal body is a dense, tough, fibrous body in the middle there, in between that vaginal opening and the anal canal opening. And why this is very much important? Why? Because there are totally like 10 muscles which are coming and merging or meeting at the perineal body. There are totally 10 muscles meeting at the perineal body. And in females, during the normal vaginal delivery, we need to give a proper support to this perineal body, guys. Now, during normal vaginal delivery, if this perineal body ruptures, all the 10 muscles, they are the one which are meeting here. If this ruptures, you can understand the consequences. The visceral, pelvic viscera will actually prolapse. That's the reason why this topic is very much important. They're asking a lot of questions from here nowadays. Now, don't think that because I'm telling it more about the perineal body only in the female, so don't think that it is present only in the female here. Let's have a comparison in the male perineum also. And yes, here also you'll be able to appreciate that there is a dense, tough body here. This body is referred to as your perineal body. Perineal body, guys. Perfect. So you do have perineal body both in male as well as in the female. Now we need to learn what are all the 10 muscles which are going to merge at the perineal body. I promise you, I'll teach you in a very conceptual manner here. You don't have to mug up that one, guys. So please concentrate here. Out of the 10 muscles, one good news here is that 4 will be paired muscles, to totally 8, and 2 will be unpaired muscle. So let us try to understand what will be the name of these paired muscles and unpaired muscle, and how to memorize them and how to learn them in a perfect manner. Look at this diagram here in the male perineum. Now in this male perineum, first of all, you will be able to see here, there will be a bulb of the penis. This is the bulb of the penis. And this here will be the crus of the penis on either side. So there will be a bulb of the penis and there will be crus. And all of them will combine together, and they are the one which are going to form the penis. Observe carefully there, the bulb of the penis will actually continue into the corpus spongiosum part. It is the lower part of the penis from where the urethra, spongy urethra, is passing from there. So bulb will actually continue to the corpus spongiosum part, whereas the crus of the penis will actually continue into the corpora cavernosa part. And corpora cavernosa part is the hollow part of the penis where blood will be filled during erection. Now, why are we actually discussing all these things here? You might be thinking, like, why do we need all these things here? Look here. Now, from the bulb, I can see that there is a muscle around the bulb. There is a muscle around the bulb of the penis, and that muscle is actually beginning from here and it is going into the corpus spongiosum part. That's the reason why doctors have named it as bulbospongiosus muscle. Bulbospongiosus muscle. That is what I want you to learn. Please don't mug up the names of the muscles. You'll not be able to remember for long term. So what is the name of that muscle around the bulb of the penis? Bulbospongiosus muscle. Similarly, around the crus, I'm able to find a muscle here. And what should be the name of this muscle now? You can clearly see it's beginning from ischial tuberosity. That is the lowermost part on which we are sitting right now. Ischial tuberosity. So because it is beginning from the ischial tuberosity, that is why ischio. And you can clearly see it is going into the corpora cavernosa part. Ischio cavernous muscle. The name of that muscle around the crus will be ischio cavernous muscle. So let me just summarize here for the last and final time here, guys. Bulb will be actually surrounded by bulbospongiosus muscle, and the crus will be surrounded by ischio cavernous muscle. Ischio cavernous muscle. It's very much meaningful right now, and it will be easy for us to remember the name of these muscles in long term. Now coming back to our concept, what is our concept here? That's perineal body. How many muscles are going to meet at the perineal body? Totally 10 muscles. And out of the 10 muscles, I got the first one. Yes, of course. Bulbospongiosus muscle is the one meeting at the perineal body. Please look at my diagram there and tell me, is it a paired or unpaired muscle? Definitely it's a paired one, guys. Okay. So we got the first pair, bulbospongiosus. But ischio-cavernous is not meeting at the perineal body. We can clearly see there, perineal body is in the center here, and ischio-cavernous muscle is towards the sides, lateral sides over there. So it is not meeting. Why I explained you about all these things, later on you will understand. Why I have built up this concept in your mind, later on you will understand when I teach you about the perineal pouches. Okay. Now, welcome to the second pair. I can clearly see that there is a muscle which is transversely present in this perineal region. Transverse perineal muscle. And you are seeing it from below, that means more superficial. So therefore, it is superficial transverse perineal muscle. STP, superficial transverse perineal muscle, STP. Now, if this is superficial transverse muscle STP, deep inside you should also have DTP, but that is not visible in this diagram. Try to understand. There will be one more muscle deep inside, that is DTP. Wow, we got the third paired muscle. So, bulbospongiosus muscle, and then superficial transverse perineal muscle, and then deep transverse perineal muscle. We got 3 pairs. And last and final one, you can appreciate here, there will be a muscle which is sloping down, which I taught you just few minutes before. That is your pelvic diaphragm, nothing but levator ani muscle. Even that is also meeting here at the perineal body. Perfectly done. So now let us write down about all the muscles which are meeting at the perineal body. So first remember that there are totally 10 muscles meeting at the perineal body. And out of these 10 muscles which are meeting at the perineal body, 4 will be paired muscles, and then there will be 2 unpaired muscles. Now what are these 4 paired muscles? Number 1, bulbospongiosus muscle. Number 2, superficial transverse perineal muscle. Number 3, deep transverse perineal muscle. And number 4 will be the levator ani muscle. Levator ani muscle. These are the 4 paired muscle, guys. Now what will be the 2 unpaired muscle? Let us again go back to this diagram here. Now in this diagram you are able to appreciate there is one muscle which is around this opening here, anal canal, or we can say the opening of the anus, anal canal. So what is that muscle? That muscle is nothing but your external anal sphincter. And is it like a paired muscle or a single muscle? Remember, it is just a single muscle there, external anal sphincter. And we can clearly appreciate in our diagram here, the external anal sphincter is also going to meet at the perineal body. So that is one of the unpaired muscle. So external anal sphincter muscle. That is one more unpaired muscle. And the last and final one, which is merging or meeting at the perineal body, will be the muscle present inside, guys, which we cannot show in the diagram there. So we cannot appreciate that muscle in the diagram here. So you just have to imagine inside you have got the anal canal, and in the wall of the anal canal you'll be actually having the longitudinal muscles. We have been learning in the entire GIT, throughout the GIT, there'll be circular muscles and longitudinal muscles. So similarly, inside that anal canal, you'll be actually having the longitudinal muscle, and those longitudinal muscles will also merge at the perineal body or meet at the perineal body. So the last and final one, longitudinal muscles of anal canal. And yes, my dear friend, that is also like unpaired muscle. That is also unpaired muscle. So in the perineal body, totally how many muscles are going to meet at the perineal body, guys? Totally 10 muscles are meeting at the perineal body. And out of that 10 muscles, 4 will be paired, and then there will be 2 unpaired muscles. And that completes this topic here. So what type of questions that they'll be asking over here, guys? Again, the same thing, that out of all the following muscle, all of them will meet at the perineal body except one, something like that. And I hope it is crystal clear here. So by this, we have completed like 3 important things in a crystal clear manner: pelvic diaphragm, the urogenital diaphragm, and the perineal body in the middle. And now let's actually go towards the perineum and learn about the perineum in detail, guys. So now moving on to the next topic, that is perineum topic. In perineum topic, the most important will be the boundaries of perineum and divisions of that into further 2 triangles. I'll tell you about that. First of all, look at a diagram on the screen over here. Let us try to define what are the boundaries of perineum exactly. Anteriorly here, you'll be actually having pubic symphysis. Okay. And then posteriorly here, there will be coccyx. Okay. And then laterally, there will be ischial tuberosity here. Ischial tuberosity over there. And if you join all of them, that will actually lead to the formation of perineum, guys. That will be the boundaries of perineum. So anteriorly pubic symphysis, try to understand it is in lithotomic position there, guys. So anteriorly you'll be having pubic symphysis, posteriorly there will be coccyx, and on the lateral side you'll be actually having the ischial tuberosity on either side. The same thing, if I just want to represent here, it will be something like this. So what do you have anteriorly here? Pubic symphysis. And what is this present posteriorly here? Coccyx. This will be the ischial tuberosity here, and this will be the ischial tuberosity here. And this is actually the ischiopubic ramus. This is ischiopubic ramus. Between the ischial tuberosity and the pubis, ischiopubic ramus. And the last and final thing, one more here. What about this ligament? I already said you about the name of this ligament. That ligament is between the sacrum on one side. There will be sacrum on one side and the ischial tuberosity on the other side. That's the reason why it is referred to as sacrotuberous ligament. Sacrotuberous ligament. So let us comfortably first of all draw all these boundaries of perineum. So moving on to this next topic here, perineum. And in perineum, let us see the boundaries of perineum, guys. Pubic symphysis and ischial tuberosity here. And then posteriorly, you'll be actually having coccyx. And this will be the sacrum. Between the sacrum and the ischial tuberosity, there will be a ligament here. That ligament will be your sacrotuberous ligament. Sacrotuberous ligament. Let us first of all write down the names, guys. All these boundaries very much important in the perineum region. So pubic symphysis, ischial tuberosity, and between them ischiopubic ramus. And the name of this ligament between the sacrum and ischial tuberosity will be the sacrotuberous tuberous ligament. So pubic symphysis, ischiopubic ramus, ischial tuberosity and sacrotuberous ligament. These are all the boundaries of perineum region, guys. Now once you are comfortable with the boundaries of perineum, the next thing will be just draw an imaginary line which is just anterior to ischial tuberosity. Not exactly the ischial tuberosity, guys, it is just anterior to ischial tuberosity here. Now because of that imaginary line, we can divide the entire perineum into two triangles. The triangle that you are able to appreciate in the front here, this is referred to as urogenital triangle. Again, the same thing. The name is very much meaningful. Why? Because you actually have the opening of urethra there and the vagina, urogenital. And I'm speaking about the female perineum, of course. The urogenital triangle. And behind will be actually having the opening of anal canal or anus. That is why this is referred to as anal triangle simply. So basically we can divide the perineum into two triangles. One is a urogenital triangle, another one will be the anal triangle. Urogenital triangle and anal triangle, guys. Done. So in one diagram we have actually completed the boundaries of this as well as the division of that into two triangles, urogenital triangle and anal triangle. Now once you are comfortably done with the perineum here with all the boundaries and its division, now let us learn about these two triangles separately. In the urogenital triangle, we are actually going to learn about the pouches, perineal pouches. Extremely important topic, and most of the students are actually confused with the boundaries of that and the contents of that. Don't get confused, guys. I'll make it damn easy for you. So the boundaries and contents of the perineal pouches, we are going to learn in the urogenital triangle. And in the anal triangle, we are going to learn the topic of ischiorectal fossa or ischioanal fossa. So we have like certain topics to be learned in urogenital triangle and certain topics to be learned in the anal triangle. Let's learn about that one, guys. So first starting with the urogenital triangle. So in urogenital triangle, we actually have the perineal pouches. I think you have heard a lot of time there'll be superficial perineal pouch and then there'll be a deep perineal pouch. Now before moving ahead with the boundaries and contents of that directly mugging up with the help of certain mnemonics, I want you all to learn in my way, conceptual manner. Just look at this diagram of female pelvis. Already you are perfect with this one. We have seen a lot of times. In this diagram, what you do is I'll just try to mark the structures here wherever you are right now in any part of the world, wherever you are studying or listening to me. Try to speak out and try to tell the name to yourself. Okay, what will be that particular structure? Now in this diagram, we are able to appreciate urogenital diaphragm and just try to tell yourself okay, what will be the name of this fascia which I have marked in the diagram over here. Just few minutes back I taught you about urogenital diaphragm, and urogenital diaphragm will actually have two fascia, one above and one below. The fascia above is superior fascia of urogenital diaphragm, not superficial. It is superior fascia of urogenital diaphragm. It's an important thing. I don't want any confusion here. That's the reason why I'm telling you a little bit slowly here. Carefully listen. And then what about this fascia which I'm marking here? Of course, that will be like inferior fascia of the urogenital diaphragm. Superior fascia and then there is inferior fascia of urogenital diaphragm. Hope you are able to recall the another name. It is also known as perineal membrane. So superior fascia, inferior fascia is also referred to as perineal membrane. Now in the same manner, like let us just come outside. From inside we are actually coming out. So when you come out in this region, you also have the skin here. And as a medical student, we all know if there is a skin, just below the skin, you will be having superficial fascia. Oh my God. That is the reason why from that time I have been stressing superior, inferior. Then if you just come out, there will be superficial fascia just beneath the skin. And that is also referred to as Colles fascia in this region. Okay. So let's do one thing here. Let's draw one schematic diagram. So from inside, first you'll be actually having one superior fascia, of course, of a urogenital diaphragm, and then there will be inferior fascia of urogenital diaphragm, also known as perineal membrane. And then from inside, if you just come outside, then this one will be the superficial fascia. and it is the one which is actually also known as Colles fascia. In this region, it is known as Colles fascia. It's actually the continuation of the abdominal fascia only, guys. In the topic of abdomen, we have learned in the anterior abdominal wall, just below the skin, you'll be actually having superficial fascia, that is Camper's and Scarpa. That itself will actually continue down to form the Colles fascia. So it's like 3 fascia there. It makes simple. Now, we all know very well, if you have like 3 fascia here, this is just a schematic thing, guys. If you have like 3 fascia here, then between those 3 fascia, you'll be actually having 2 pouches. If there are 3 fascia, then there'll be 2 pouches. And the naming of those 2 pouches should be given from outside to inside. So this is more superficial perineal pouch, and this is more deep inside, that is your deep perineal pouch. Awesome. So the entire concept becomes easy with the help of just 3 lines there. Superior fascia, inferior fascia, and superficial fascia. Between the superior and inferior, deep perineal pouch, and between the inferior fascia and superficial, there will be superficial perineal pouch, guys. Things becomes easier in this manner. And exactly the same has to be in the males also. So let us just try to have a comparison now. The female perineum with the male perineum now, sir. In the male perineum also, you are able to appreciate that there will be superior fascia of urogenital diaphragm. Then below that, there will be inferior fascia of urogenital diaphragm, also known as perineal membrane. And then this one here will be the Colles fascia or the superficial fascia of the perineum region. So therefore, what about this pouch here? This one here will be the superficial perineal pouch, and this present deep inside will be your deep perineal pouch. Superficial perineal pouch and deep perineal pouch. So similarly in the females here, in this diagram, yes, this will be the superficial perineal pouch here, and this will be the deep perineal pouch, guys. So if you just follow my concept here, remember these 3 lines, between those 3 fascia will be actually having the 2 pouches. Things will become easier instead of mugging up individually and randomly here and there. Now same old practice as we have been doing from that time, remove one structure and study about that in detail. So here also in this diagram, we are going to remove this much part in the female and similarly this much part in the male, and this is how it looks like. This is the perineal pouches in female, and this will be actually the perineal pouches in male. Perfect. So let us just draw the diagram here and write down the notes simultaneously. So the entire concept is done. Let us just write the notes and finish it off. So deep perineal pouch. Now what will be the boundaries of deep perineal pouch, sir? First let's begin with the deep perineal pouch. Now what will be the boundaries of deep perineal pouch? Superiorly, you'll be having superior fascia of urogenital diaphragm, and below inferiorly you'll be actually having inferior fascia of urogenital diaphragm. But remember the another name of that one, it is known as perineal membrane. Perineal membrane. Then what do you have laterally, guys? I'm done with above and below. What do you have like laterally? Try to recall when I taught you the boundaries of perineum. That's the reason why I taught you the boundaries of perineum. In the boundaries of perineum, where do you have these pouches? These pouches are present in urogenital triangle or anal triangle behind. It's in the urogenital triangle. And urogenital triangle on either side will be having ischiopubic ramus. So that is going to form the lateral boundary of both the pouches. So laterally you'll be having the ischiopubic ramus. Ischiopubic ramus. So superior, inferior, and laterally we're actually having the ischiopubic ramus. And you don't have to worry about the anterior and posterior, guys. Why? Because anteriorly and posteriorly those fascia are just merging. Okay, they're fusing. So there'll be fusion of the fascia. So not that much important. So don't waste your time in unnecessary things here. These are the important ones that you have to at least remember. Don't worry about the anterior and posterior. Now once you are done with the boundaries, the next thing will be what will be the contents of deep perineal pouch now. The good thing here, the good news here is that out of the contents, 2 contents you already know. Try to recall. So it's all about that 3 lines, guys. You should always have that 3 lines in your mind and the concepts are going to become very much easier. So you already know the 2 contents here. Which 2 contents? Guys, where are we basically right now? Superior fascia and inferior fascia of urogenital diaphragm. So what do you have in the middle? Of course, the urogenital diaphragm there. And what is that urogenital diaphragm made up of? Just few minutes back I taught you, it will consist of two muscles. One will be the external urethral sphincter, muscle, and another one will be the DTP, deep transverse perineal muscle. So these two are the muscles which are going to form the urogenital diaphragm, and those two are present over there between the two fascia. Easy to remember. And it even makes sense in the deep perineal pouch, we are actually having the deep transverse perineal muscle. Deep transverse perineal muscle. Now after this, again come back to this diagram here in the males. Let us just quickly revise again, guys. What is this one? This is superior fascia here. And what is this one here? This is the inferior fascia here. There is nothing but perineal membrane. And between them, this pouch here will be the deep perineal pouch. Okay, perfect. Now, I want all of you to please focus onto the urethra right now, guys. Male urethra. Male urethra is a long one, almost approximately 20 centimeters long. And first of all, that male urethra is going to pass through the prostate gland. This will be the prostatic urethra. Then a small part which is going to pass through the deep perineal pouch. That is membranous urethra. And the remaining, the entire thing will be in the penis. That is the penile urethra. From here, we can easily say what is the content of deep perineal pouch? Membranous urethra. That is membranous urethra. And around that membranous urethra, you are able to appreciate here itself the sphincter, external urethral sphincter muscles. Perfect. Apart from that, are you all able to appreciate one gland here? That gland is bulbourethral gland of Cowper, very famously known as the Cowper's gland in male. So Cowper's gland in male is present in the deep perineal pouch. But I want to tell you one important thing here. Hope you're able to appreciate that in the diagram here, guys. Even though the Cowper's gland is present in the deep perineal pouch, look at the duct of that. The duct of that is present in the deep as well as in the superficial perineal pouch. Deep as well as in the superficial perineal pouch there. Perfect. So let's make a note of this one here. Content number 3 in the deep perineal pouch will be membranous urethra, but that is only in the male. Content number 4 will be bulbourethral gland of Cowper, or simply Cowper's gland, and even that is also in the male here. But remember about the duct. I'm telling you again, the duct of the Cowper's gland is present in deep perineal pouch, and then it is going to pass through the superficial perineal pouch also. Superficial perineal pouch also, guys. That is about the deep perineal pouch contents here. Now what else, guys? That is about the deep perineal pouch, and now the next thing that we need to learn is about the superficial perineal pouch. So let us learn about the superficial perineal pouch right now. Superficial perineal pouch. Again the same thing. First thing what we are going to learn here, the boundaries. And for boundaries, we have already made it easy with the help of that 3 lines. Try to recall in your mind. What do you have superiorly? Superiorly, there will be inferior fascia of urogenital diaphragm, which is also known as the perineal membrane. What do you have inferiorly? Inferiorly, you have to be very much careful here. Here you'll be actually having the superficial fascia of perineum region. And that superficial fascia of perineum has got a special name here. It is also known as Colles fascia. Just try to recall that 2 lines, inferior fascia as well as the superficial fascia. So perineal membrane and the Colles fascia. And then what do you have laterally here? Again the same thing. The 2 pouches, the deep perineal pouch and superficial perineal pouch, both of them are present in the urogenital triangle. That is why what do you have laterally? Laterally you'll be having the ischiopubic ramus. Ischiopubic ramus there. So that will be the boundaries of superficial perineal pouch. As I said, you don't worry about the anterior posterior. It's all about the fusion of the fascia there. The fascia is coming and fusing with this one. So you don't have to worry about the anterior and posterior. Now, after writing the boundaries here, the next thing is the contents of superficial perineal pouch. The first content which you can easily remember, in deep perineal pouch, you actually have the deep transverse perineal muscle. Definitely here in the superficial perineal pouch, superficial transverse perineal muscle. One thing is easy, so you can just turn the page back and refer if you're not able to recall. So deep perineal pouch, we have got DTP muscle, deep transverse perineal muscle, and here in the superficial perineal pouch, we have got STP muscle, superficial transverse perineal muscle. Then number 2 and number 3, it will be like easier. Why? Because I have explained you the concept in detail before itself. Now again, welcome back to this diagram. Now in this diagram, this one here will be the perineal membrane, and it is not shown here, but imagine somewhere here will be the Colles fascia. If that is a perineal membrane and Colles fascia, definitely this pouch here will be the superficial perineal pouch. And if that is your superficial perineal pouch, with full confidence, you can answer me here. Yes, you are able to see the bulb of the penis. And the moment you are able to see the bulb of the penis over there, without any doubt, on either side of that, you are able to recall that there will be crus. I have explained you that few minutes back in the perineal body topic, guys. That's the reason why I explained you. Now the things will become easier. So in the middle, you're actually having the bulb, and on either side, you're having the crus. Why we are not able to see crus in this diagram here? Why? Because we have taken a mid-sagittal section. Exactly in the middle, we have taken a sagittal section. So if there is a bulb, on either side, you'll be actually having crus. So just write down there, number 2, second content here will be the bulb. Both in male and the female, it will be there, guys. And on either side of this, there will be crus. Now, the moment I'm writing bulb and crus, I hope you are able to recall in your mind. If there is a bulb present there, around the bulb, there is a muscle, bulbous spongioses. Even that should be present here. And if there is a crus present there, around the crus, there is a muscle, ischio-cavernous. Even that should be a content here. It makes the things easier. So, if the bulb is present there, there will be bulbo-spongiosus muscle along with that one there. And if the crus is present there, there will be ischio-cavernous muscle along with that. There will be ischio-cavernous muscle. Then the content number 4. Now we have from that time we have actually seen the diagram only in the males here. Now let us try to see the diagram in the female, guys, in the female perineum. Now in the female perineum, we are able to appreciate one gland here. This gland will be the greater vestibular gland, which is also known as the Bartholin's gland in female. And that is another important content to be remembered about. So let us write down here, greater vestibular gland, or else very famously this gland is also referred to as the Bartholin's gland. But important, it is present only in the females, not in the male. So Bartholin's gland in the female is present in superficial perineal pouch, whereas Cowper's gland in the male, it will be present in the deep perineal pouch. Keep that point in mind. Now these are the contents which I want my students to remember. You don't have to worry about all the contents, guys. If you see the same topic in your textbooks, you will actually go mad. There's so many contents given over there. And I don't want you to remember all of them. Why? Because, for example, you also have pudendal nerve. You also have the internal pudendal artery, internal pudendal vein. And now we all know very well they are present in both the pouches. And if it is present in both the pouches, try to understand the mindset of the examiner. Will he ask you about the contents present in both the pouches? It doesn't make any sense. So most of the time it will be all about, the contents present, all the contents present in one pouch, except one. Similarly, all the contents present in superficial perineal pouch, except one. These type of questions will come, and they will never give you the contents present in both the pouches there. So don't have to worry about them. So study very smartly, try to learn the contents which are present in particular pouches there. That's all. Don't have to learn the contents which are present in both the pouches. Hope it's making some sense now. Now, apart from that, is there any any other thing that you have to remember here? I'll tell you one more thing to be remembered. And this time we'll do one thing, we'll draw the diagram. So whatever this diagram I have been showing you from that time, let's draw this diagram here. For example, if this is the superior fascia of urogenital diaphragm, And this one here is the inferior fascia of the urogenital diaphragm, which is nothing but perineal membrane. Between them there is a pouch formed, and this pouch is deep perineal pouch. Deep perineal pouch. Perfect. And as I told you, don't worry about the anterior and posterior, only there is a fusion of this fascia, so you don't have to worry about that one. Now what do you have, what is it, urethra, the prostatic urethra, and then the prostatic urethra is the one which is going to become the membranous, and membranous urethra will continue down into the penis as penile urethra. There will be prostatic, then the membranous urethra, and this one will be the penile urethra. So here there will be bulb of the penis, and then there will be shaft of the penis here, guys. And then what about the superficial perineal pouch? See, actually there is a fascia, superficial fascia in the abdomen region, that will continue down, and that will further continue down, and it is going to form a fascia in the scrotum, that is the scrotal fascia, which is also referred to as your dartos fascia. And this will continue above here as Colles fascia, and that Colles fascia is going to fuse with an extension coming from the perineal membrane. So basically, where exactly you have the superficial perineal pouch, the superficial perineal pouch is this one here. And again the same thing, please don't worry about the anterior and the posterior. Why? Because it is just about the fusion of the fascia that you are able to see there, guys. So deep perineal pouch and superficial perineal pouch. So all the contents are comfortable there. You don't have to worry about any content there. In deep perineal pouch, you are able to appreciate there membranous urethra. That membranous urethra is surrounded by a sphincter, that is external urethral sphincter. And then you'll be actually able to appreciate one gland here, that is bulbourethral gland of Cowper. And the duct of that will be present in the superficial perineal pouch also. And lastly, you'll be able to appreciate one muscle here transversely, that is your DTP muscle. So whatever contents I have shown you, all the contents that you are able to see here in the deep perineal pouch, guys. So no confusion about all these contents. Now basically what I am trying to teach you here, there is one more content that is trying to create some confusion among the students nowadays. Just behind this deep perineal pouch here, you'll be actually able to see the canal, that is your pudendal canal. Just I am drawing a schematic diagram here, guys. Imagine this one to be the pudendal canal. Now obviously in the pudendal canal, you'll be actually having nerve, and that nerve will be the pudendal nerve. And then pudendal nerve will come here. That pudendal nerve is a content of your deep perineal pouch also. I'm just drawing it schematically here, guys. And then in the deep perineal pouch, it is going to give rise to a nerve. That nerve will be the dorsal nerve of penis. Dorsal nerve of penis. And remember, this dorsal nerve of the penis, it is only and only the content of deep perineal pouch. Dorsal nerve of the penis, it is only the content of deep perineal pouch. Perfect. And then the same pudendal nerve, it is also going to give like one more branch here, and that branch is going to actually bypass this one here. It's not given in the deep perineal pouch, it's actually given before entering into the deep perineal pouch only, and that will be the posterior scrotal nerve. Posterior scrotal nerve. And this posterior scrotal nerve is the content of only the superficial perineal pouch. It is not the content of deep perineal pouch. So I want a clarity in this one here. First of all, remember about the pudendal nerve. Pudendal nerve is coming through the pudendal canal, and then the pudendal nerve will actually give like one branch, that is dorsal nerve of the penis, that is the branch, or that is the content of only deep perineal pouch, whereas the posterior scrotal nerve is actually the content of superficial perineal pouch. Okay, I hope there is a clarity between these two nerves, and these options are given nowadays in the exam, so please take care about this one here. Now once you are comfortable with the superficial perineal pouch and the deep perineal pouch, the boundaries of that and contents of that, let me just finish this topic here by telling you about the clinical aspect here. the clinical correlation here, guys. And that clinical correlation is actually about extravasation of urine. Okay, if there is a rupture of this urethra, then what is going to happen? There will be extravasation of urine. Sometimes what will happen, the manhole, when you are going on the road, the manhole, the municipal corporation people will be working, and sometimes it will be kept it open. And during the night time when you're walking, they might be accidentally, you will be falling into that one. So there'll be hit in this region, in the perineum region, that is nothing but leading to injury or rupture of the urethra, guys. That is one example. Or else, like, or while riding a bicycle on bumpy roads, it can also lead to a rupture of the urethra. So in those cases, what is going to happen? Let us first of all try to understand with the help of this diagram, and I'll make you write on the notes. Now in this diagram, you're able to appreciate here, this one will be the membranous urethra. And if there is a rupture of membranous urethra, above you'll be able to see the urinary bladder having urine in that, and that urine is going to come out here, and instead of going out, what is going to happen? The urine will extravasate out into that deep perineal pouch. Urine will move out into this deep perineal pouch. So when there is a rupture of membranous urethra, the urine is going out more or less only in the deep perineal pouch only. But if there is a rupture of this spongy urethra, or we can say the penile urethra, that is very bad condition. Why? Because the urine will be extravasating out into the superficial perineal pouch. That is further in continuation with the scrotum. So the urine will also go into the scrotum here, scrotal sac. The urine will also go down into the thigh, up to a line there, which is also referred to as like Holden's line. That is a line which is actually the representing you the connection or the attachment between the fascia in the perineum region, that is Colles fascia, with the fascia lata in the thigh. That is Holden's line, up to Holden's line. And then the urine can also extravasate into the anterior abdominal wall and into the anterior abdominal wall up to all the way up to the axilla, guys. So that is one important clinical application of this perineum region. So let's just write that and finish it off. Extravasation of urine. Extravasation of urine here. First thing, if there is a rupture of membranous urethra. Yes, if there is a rupture of membranous urethra, then you'll be able to see the urine extravasating out only in deep perineal pouch. So urine in deep perineal pouch. Condition number 1. And if there is a rupture of penile urethra getting ruptured here, then you'll be seeing urine going in various structures. So urine will be seen in superficial perineal pouch, in the scrotum, and even in the thigh up to Holden's line. And then it will also be seen in the anterior abdominal wall up to axilla. That's one very important clinical correlation here, guys. So if there is a rupture of this urethra, then the urine will be extravasating out into the deep perineal pouch and the superficial perineal pouch, and you have to understand this condition over here. Fine. So that is about all these topics in sequence. Try to learn them in the same sequence, guys. The pelvic diaphragm, urogenital diaphragm, perineal body, and then the boundaries of perineum. Divide that into two triangles, urogenital triangle and the anal triangle. And then in the urogenital triangle, learn about the perineal pouches and the boundaries and contents of that. I think relatively now it has become easier and in a very conceptual manner, guys. That's all. Thank you.